use block scheduling. Now, I'll guarantee, Naren, right now, we have listeners that are saying, I used to use block scheduling. What in the world ever happened to that? They used to use block scheduling. It worked really well. And then over time, it evaporated. It evaporated. So if you're a listener and that's your current listening reality, know you've got a lot of company. Naren, systems in a practice have a way of naturally eroding over time. They naturally erode. It's not bad people or anything subversive. It's just that they have a way of eroding. If we add a new team member, maybe they were never fully trained on that system, and they bring new information in, and next thing you know, our whole system is completely morphed into something else. So let me really quickly go through some fundamentals of block scheduling. And this has to do with the concept. I'm going to label 3 different types of appointments in the practice. And I want to give credit where credit is due in this. I learned this many, many, many years ago from a colleague of mine, a coach. She's now retired, but her name is Jennifer D. St. George. And some of you will have a flashback when I bring up that name. Jennifer D. St. George, who's from England, had this beautiful, she relocated to California and lived in California many years, but she had this beautiful English accent. And Jennifer used to talk about scheduling using the rock, sand, and water concept. Let me take a minute and explain it. Imagine that you have a vase, a glass vase, and you're going to fill it with 3 different ingredients. And imagine that one of those ingredients are smooth river rocks, maybe about half the size of the palm of your hand. And you're going to take and you're going to fill up that vase, and you're going to get the vase to the very top. And if you put one more rock in it, and it would overflow. I would ask you a question: is the vase full? And some people would think, well, if I put one more rock in, it would overflow. So yes, it's full. But in fact, no, it's not full. Because now I could take the next ingredient, sand. And imagine that the sand is very finely grained white beach sand. Maybe it came from the island of Maui in Hawaii that has beautiful white sand beaches, very fine. And now we take that sand and pour it into the vase, pour it into the vessel. What's going to happen to that sand, Naren? What do you think would happen to that sand if I put it in the vessel?
It will go and fill in the extra space between the rocks, right? It'll just literally like go down and
it'll filter down.
Yeah.
And it will fill in the spaces between the rocks. And if you pour the sand slowly, you will eventually get to the top. And now if I put one more grain of sand in, the grain of sand would fall out. I'd ask you the question, is the vessel full? And you're a little bit wise to me at this point. You say, wait a minute, no, because I could take water. And I could take water and slowly pour it in at the top of the vase, and it would filter in between the sand and the rocks. And
that is correct.
When we finally get to the top, if I put another drop of water, the vessel would be full. Well, the analogy of rock, sand, and water, the vessel is your schedule, is your appointment book. And the ingredients, rock, sand, water, are the types of appointments you put in your schedule. The ideal day will have a mix of all 3 of those elements, rock, sand, and water. But what's really important to remember is the order in which you put them into the vase. Naren, what would happen if I filled the vase with water to the top? Is it full?
Yes.
And if I dropped a rock in it, what would happen?
The water will spill out.
Right.
Because it's already full. In other words, water is the last ingredient. If you put it first, then you can't put anything else.
You want to put the proper order in. You want to put the rocks in your schedule first.
Right.
Then we put the sand in, and then if anything's left over, we can fill those with water. We can use that as fill.
Right.
Rocks represent your production blocks. Sand represents minor production, and water represents little or no production. And so you have to define what are the rocks in your schedule.
So for example, Invisalign could be rock, right? Or
absolutely could be rock.
Yeah.
But let's think more traditional general dentistry. A crown is definitely a rock.
Right.
If you do root canals would be a rock. Oral surgery, would be a rock. If you're doing, 2 crowns, that would absolutely be a rock. Fillings.
So this is what we call high value services, kind of, right? So
I'm talking general dentistry.
Dentistry, right?
I think of high value services, things like implants and smile
veneers
and those kind of things.
Right.
But I'm talking about everyday general dentistry. And so the Fillings could be a rock if you do enough of them. If we're doing a quadrant of fillings, that
Hmm.
could be a rock. But if you're doing a single the tooth to surface, that's sand.
Right.
So define what the rocks are in your practice based on your mix of services. Define what your sand is, and then define what water is. An example of water might be a suture removal, Aaron, or a post-op check might be considered water.
Let me ask you
Uh,
this, Gary. So let's say the doctor wants to produce $5,000. I just made up that number in one day, right? Now, what percentage of them should be rocks before we start putting the sand in?
Well, a simple model would be to have three different lengths of rock appointments in your schedule. For
Okay.
example, one might be an hour and a half rock, and the other two might be 1 hour rocks. So that would represent 3.5 hours of the 8 hour day filled with
Right.
rocks. So you put those in the schedule first. You literally block schedule. And doctors, I would suggest that you not only go out for the rest of this year, 2022, but go out for all of 2023 and put those rocks in your schedule. You want to put those in the schedule first. Put those rocks. Now, the other type of appointment that I want you to block schedule is the doctor part of the new patient exam. The doctor part of the new patient exam. Because that's a captive appointment. Now, question, Aaron, is the doctor part of the new patient exam rock, sand, or water?
Well, it's a rock long term. It may not be a rock today. In other words, that patient
It's
could
not a
could
rock in
present
terms of production,
$20,000 in dentistry, right? Or $30,000 in dentistry.
but it's not a rock in terms of production.
It's not.
It's not. So I would call it sand with the potential to be a rock.
Oh, okay.
So
Okay.
it's sand with potential to be a rock.
Makes
You
sense.
want to block your schedule for those because you want to be able to accommodate new patients soon, from the time they call. So figure out what your new patient flow is. If your new patient flow is 2 a day, if it's 3 a day, then put those blocks in. I teach our clients to use a 30-minute block for the doctor part of the new patient exam. And if they see 2 a day, those need to be in there as well. So again, let's go back to our schedule. 3 rocks, maybe 1 hour and a half to 1 hours. They're 3.5 hours. And then let's say the office sees 3 new patients a day, just hypothetically, 3 half-hour blocks. That's another hour and a half. I'm at 5 hours filled of the 8 hour day, 3.5 plus an hour and a half. And then whatever you put the rest of the day, you can just fill in because you're likely to hit your goal because of the fact that you put the rocks in there first. So go back to the block scheduling using rock, sand, and water.